This thing most people do when they want to sneeze. Like normally when you want to sneeze, you should sneeze. But because you're in a public, probably you don't want to feel embarrassed. You not do you hold it back. It's called stifling of sneeze. If you do that, stop it, and I'll tell you why. When you do this, first of all, sneezing is supposed to be a reflex action, meaning that it's something you cannot control, right? And it's a way of easing out allergies, irritants, all to make you feel better. Ordinarily, when you sneeze, you feel better. When you stiffen your sneeze, aside the fact that the irritants go back, this also builds up pressure. I mean, it builds up pressure on the blood vessels, which can lead to rupture. Blood vessels around your throat, your nose, your lungs, and even your ear. If this happens on the nose, if they rupture the blood vessels, the build up of the pressure in your nose can actually lead to, that is, accumulation of mucus in your sinus cavities. Remember that you're trying to take out this thing, but now you're taking it back in. So when you take it back in, it enters the sinuses that are supposed to be empty. Of course, these are infected mucus. What you're sneezing out is supposed to be infected. Like it is a waste product. When you take it back in, this can lead to sinusitis. That is inflammation of the sinus cavities and leading to pains around your facial region. That is your cavities. It can result to pain. Do you understand? And then when it happens, when the rupture occurs in your ear, it can lead to middle ear damage. That is the eustachian tube damage. And this can result to hearing loss. It can result to vertigo. That feeling of spinning, like you know that merry-go-round thing that we did when we were younger. This merry-go-round, after doing it, you now feel like you're moving round. I be the sun, like the world is moving around you. That kind of a thing. That sensation, this thing can actually cause it. It can actually cause. And then, even in severe cases, it can lead to lung infection, a situation known as pneumothorax. These are in severe cases, though it's usually rare. But the long and short of it is this pressure build up that you take back in, it is not healthy at all. So please, the right way to do hygienically, demure and all, aesthetically, move around with your handkerchief, move around with your tissue papers. And in occasions where, you don't have any of these, I mean, there are always occasions like that. Use the crook of your elbow. This is your elbow, right? Use the crook. When you want to do that, you just do like you just get it away. I hope this helps.